Lightning
Thanks,
round?
John. Dr. Carson.
Yeah, this will be the lightning round because we don't have a lot of time.
Sure, and I think that one of the biggest questions after listening to you tonight, it's been an absolute pleasure, is have we gone too far? Do you think that America can come back from where we are today?
Great question.
I do think that. That's why I wrote the book, because I think we have what it takes to do it. We're just going to have to speak up. That's the key.
Jamie?
It's January 2017. You've just been inaugurated President of the United States. What would be your top legislative priorities?
Well, assuming that things are continuing the way they are now, we got to get the economy working again, because that will take care of the jobs. Productivity rather than just mindless jobs.
All right, Leslie.
Doctor, when you say things people don't want to hear, usually there's an immediate effort to delegitimize the speaker. Were you concerned about that before you made that speech in that forum with that audience?
I wasn't concerned because there's nothing that they can do to delegitimize me. There's no skeleton that they can find. They're going to try. Good luck.
Yeah. You actually said in one of your speeches, live a clean life. You don't have to worry, and don't lie because you don't have to worry about what you said 3 months ago. I read that.
He's good.
Kerry.
Doctor, in the 1960s, you had Ronald Reagan speaking out against socialized medicine for the AMA. The AMA made a complete 180 and was speaking out for Obamacare. What happened?
Well, first of all, only 23% of doctors belong to the AMA. And they go and they grab those ones and they say, this represents the AMA. Enough said.
Betsy?
I'd like to know how you would solve this problem as a doctor and also as President of the United States. Section 1311 of this law empowers the federal government.
Law.
The Obama health law empowers the federal government for the first time in history to dictate how doctors treat privately insured patients, even if you bought a plan like an Aetna plan or a Cigna plan and paid for it yourself. How will you protect that doctor-patient relationship?
Probably by rewriting that law.
Good answer.
Doctor, thank you so much for speaking your mind. I certainly hope you keep it up in the future. But who in the current debate reflects your values and views the most effectively of anybody in politics or public life?
Well, I certainly enjoyed what Senator Rubio had to say last night. And I'm sure there are many up-and-coming young people, Bobby Jindal, and we'll just have to keep looking and hoping that people are courageous and forward-thinking.
Heather?
Does a message of personal responsibility sell politically anymore? We've seen President Obama suggesting universal pre-kindergarten care, basically telling parents that it's not their responsibility to prepare their children for school, but rather the government's. I don't think your mother would have bought that message. She understood that it was for you to do that, but we seem to be expanding things that the government can do instead of individuals.
Yes.
Can a politician stand up and say, sorry, we're not going to give you any more programs? It's for you to take care of your lives?
I think it can sell, but we have to start talking about it. You see, the politically correct police have silenced the debate. We have to create the debate again, and a lot of the people who are in the middle will have an aha moment.
Stefano.
The speech with the part about your mother touched me so deeply as a mother of young boys, and I'm wondering how can we best limit the government in a way that creates a million Mrs. Carsons raising up her sons and herself out of poverty into prosperity. How do we do that?
We become smart voters. And you know, a lot of people, they go into the voting booth, they say, oh, there's a name I recognize. Yeah, I'm voting for that one. That's about all they know. If you don't know more than that, you probably should just not vote, or you need to go and teach yourself, because you could be voting against your self-interest.
Dr. Siegel,
Carson, do you think the president heard you? I was hoping that with everything that had happened, that he'd come up to you afterwards and say, I heard you. Do you think he heard you?
I'm praying that he did. If he did, you should see some changes in his actions.
Avik?
You would, you're based in Baltimore, and you touched on Medicaid earlier, and as you know, the health outcomes of patients on Medicaid are a lot poorer than they are for private insurance because it underpays docs and underpays hospitals. But this is the big debate in states around the country, is whether they should expand their Medicaid programs as Obamacare requires them to do. If you were advising the governor of Maryland, what would you tell him to do with the Medicaid expansion?
Well, I would say we need to start talking about something that makes sense. You know, it doesn't make a lot of sense to invest a lot of our eggs in something that doesn't work.
Jedediah, real quick.
Yeah, I'm a former teacher and dean, and I just want to know, how do we get young people to care about the debt and deficit?
I think we have to give them examples, like the one that I gave, 507,000 years, so they begin to understand what they're facing.
I'm sorry, we missed 3 people. Go ahead, Mary, quick.
I was just going to say it's easier to be ignorant and reliant than it is to be responsible and informed. How do you change that?
Well, one of the things we're going to have to do, and I don't have a lot of time to get into it, but we have to use technology. There are some wonderful ways that we can use that. Virtual classrooms that can help us enormously. I'm working on that project with something in Baltimore right now.
And you have your scholarship fund, and it's on
Absolutely.
the web at
carsonscholars.org.
All right.
Everybody get involved.
All right. Dr. Carson, thank you very much.
Thank you very much.
Great honor to have you.
Absolutely.
And that is all the time we have left. As always, thank you for being with us. Let not your heart